So what we do here is we help restart something called the disc pump mechanism. The disc pump mechanism is a way that the disc heals itself and helps it keep it hydrated and resilient. So if you imagine the disc, which is made up of 86% water, as a sponge. When we push down on that sponge, the water comes out, the metabolites and carbon dioxide, and we left our hand off of it, it sucks that water back in with the nutrients and oxygens that it needs to heal and repair. That is simply how a disc breathes. It's called the disc pump mechanism, or imbition. And so to stay healthy and resilient, we need that to be intact. If it starts to fail, too much stress or trauma, then what happens is that disc becomes more decreased in size, in space. So what we need to do is start with that disc pump mechanism and restart it so that we can get that disc more hydrated and back to its more resilient state. The way that we restart the disc pump mechanism is that we harness in above and below where that disc is, and we simply apply a gentle pressure to kind of pull the vertebrae apart. It's very subtle, but it helps to stimulate a negative vacuum effect, sucking any disc bulges in, and also stimulates to push more water into the disc and get it more hydrated. We repeat that cycle many times. Disc decompression is something that we do over many visits in order to help restart that pump mechanism and get it the healthiest and height that we can possibly get it. If traditional medicine, chiropractic, and physical therapy have not been a solution to your pain or your problem, you might have a disc pump mechanism issue going on. And the only way that you're going to solve that problem is to specifically target the disc. And that's what we do here. We use class 4 laser regenerative therapy and spinal disc decompression in order to help getting that healing and repair mechanism of the disc, creating more room for the nerves to live and breathe, thus giving you the relief that you're searching for in the long term. If you've never looked into this kind of technology before, please come visit our office and see if you're a candidate for this type of procedure.